I'm Aaron Wendelboe. I'm a professor of epidemiology. I'm in the Hudson College of Public Health, and I've been here at the university since 2008. Prior to that, I worked for the Centers for Disease Control and Prevention as an epidemic intelligence service officer. So I mentioned that because my passion and career goals have really been to bridge applied and academic public health. And so I believe maybe today we can talk about both aspects of public health and infectious disease epidemiology. I wasn't really introduced to it via anyone I really knew or via my class work. I was very interested in applying for medicine. I had been involved in health occupation students of America in high school, and but just didn't really realize how many occupations there were outside of, say, being a doctor, a nurse, or a pharmacist. And so I actually didn't get accepted to medical school my first year, and so I applied to do a master's in public health and then took my first epidemiology course and learned then about this career, and it actually really jived with the way I think and the way I perceive the world. I was one of those kids in your science class when they would teach you some concept. I would ask the teacher, well, how do we know that? And I was trying to have a healthy skepticism of just learning, because I know that science changes all the time, and so I wanted to understand the reasons behind that. And it was just amazing when I took that first epidemiology class. I saw that they addressed questions like that. Not only did they say, stop asking questions, they said, please ask these questions, keep asking why and how we know it and how confident we are in our answers. Yeah, I think that epidemiology is a great option for somebody who wants to just keep learning. You'll probably do something different your entire life. And in fact, a lot of my colleagues when I worked for CDC were people who had trained as physicians or nurses that really kind of felt burnt out in the clinical practice and felt like they wanted to do something a little bit more, something new, something engaging. Prior to COVID, I interacted certainly with a lot of different disciplines, but since COVID, that group of interdisciplinary colleagues has really grown. So I would say the most common ones would be analysis, biostatisticians, as well as clinicians, again, doctors, nurses. But then as COVID has affected all of us, I've been working with sociologists, I've been working with people in risk communication, and I've also worked with politicians and whatnot, so it's really been interesting. So first I'll talk about more a career in applied epidemiology, because we have such a shortage of public health workers, and honestly, the excitement is in when you're working in a health department or say for CDC. When I was working for CDC, I was assigned to the New Mexico State Department of Health, and basically the whole state was in my jurisdiction, and so we had, like I said, everything was different. And in fact, one of my roles was to be on-call, and an on-call epidemiologist is kind of like an on-call physician, except we're receiving calls from a wide range of people, including the general public or physicians or basically anything. And so one day I might be responding to somebody who was bit by a wild animal, maybe a bat, and they didn't capture the bat, so they didn't know if they were exposed to rabies. Or another time I got a call from a hospital where they had had an increased number of patients who had died following heart surgery. And then another time, there were a bunch of infants that got this rare disease called necrotizing enterocolitis. And so, and of course, I cannot be an expert in every single one of those subjects, but I got experience while working in that role. But then going back, as we talk about working with interdisciplinary teams, you're not expected to know everything. You can work with others. It's a lot of teamwork, and then you also figure out, like I said earlier, just how we keep learning. You have those research skills, and I learned how to look at the published literature and look at reports so that I could learn about rabies or necrotizing enterocolitis, and that really facilitated me to do my job. My advice would be to just get a well-rounded education. I think that we really accept students from not just the sciences, but we've had very successful students from English or other humanities backgrounds even. It's helpful to be comfortable with math, but you don't need to be a mathematics expert. It's helpful to have taken some science classes like physiology or anatomy, but you don't have to be an expert in it. And so I think, like I said, I think the biggest advice is just you want to come expecting that you start a career of learning, but the rest of your career is also just going to be you learn how to learn and you keep practicing that the rest of your life. I would just really advise anyone to take a quick look at epidemiology. You could potentially mentor somebody at the health department. It's one of those careers that I think once you have a little bit of exposure to it, you'll be attracted and just think, why didn't I ever know about this, say in high school or in earlier like career fairs or something like that.